So far, overall, the good news is that generally COVID-19 infection does not produce severe outcomes, doesn't tend to lead to serious illness. But of course, it does happen from time to time where we get cases where children end up getting seriously ill and may require hospitalization or have even more significant and severe outcomes and impacts. But again, to my mind, that is just yet another reminder to all of us to do everything we can in our power. That's certainly what we're doing at Toronto Public Health, to facilitate the ability for people to actually take up the protective benefit of vaccine.
Toronto Public Health has confirmed a child under the age of 4 has died after contracting COVID-19. According to provincially published data, there have been 2 COVID-19 related deaths reported in this province in the under 19 age group in the past 2 weeks. Also today, Wellington Dufferin Guelph Public Health confirmed the death of another child who tested positive for COVID-19, a girl under the age of 10. It comes as GTHA hospitals urge pregnant women to get vaccinated. Doctors are concerned about recent infant hospitalization because of COVID-19. Joining us tonight, Dr. Dina Kulik, a pediatrician and the founder of Kid Crew. And we also have Dr. Alan Grill, the chief of family medicine at Markham Stouffville Hospital. Good evening to you both. Dr. Kulik, I'll start with you. What are you seeing in some of your patients right now in your clinics?
Luckily, our patients at Kid Crew are doing very well. We have had a huge surge of cases, though, in the thousands in the last couple of weeks. Many of our patients having cold-like symptoms, flu-like symptoms, but most are staying quite well, and very rarely are they requiring any kind of hospitalization or even emergency care.
And what kind of symptoms are you seeing in some of the children who you're taking care of who are displaying symptoms of COVID-19?
The vast majority of kids have flu symptoms, so they might have fever, runny nose, cough. Many children have stomach flu type symptoms, so belly pain, vomiting, diarrhea, and many have sore throat.
Mm-hmm. Dr. Grill, what are you seeing? Are you seeing parents who are bringing children in with serious COVID symptoms? Perhaps even those parents aren't sure if a child has COVID because they aren't eligible to be tested at this point.
Yeah, it's an excellent question. I mean, every winter, even pre-pandemic, when viruses increase in the community, you're going to see more kids getting sick, right? Kids interact with each other, things spread around. So now that Omicron is spreading so much in the community, it's not a surprise that more kids are starting to come down with it. We're starting to get more calls and visits with parents and kids that are coming down with symptoms. A lot of family physicians are starting these COVID at home programs where if we suspect that whether a child or an adult has COVID-19, and right now we're going based on symptoms mostly because we're prioritizing PCR testing, not for the general public, but more for people with chronic medical conditions. We're assuming a lot of people have COVID-19, and we're starting to set up these programs where we can monitor them at home. We can keep an eye on things. If their symptoms start to get worse, we can direct them to hospital if needed. So yeah, I mean, I suspect we're going to see more even in the next few weeks, considering the amount of spread that's going on in the community.
Mm-hmm. You mentioned receiving some questions from parents. What kind of questions are you getting?
I mean, often parents will ask us, if their child is sick, and it's very similar to when we see kids, with routine colds in times when we're not in a pandemic. What do I look out for? When do I know if things are getting worse? And it's a very similar conversation that we'd have now with COVID-19. We would tell parents what the common symptoms are, as Dr. Kulik mentioned, and we'd want to identify red flags, right? So if you're dealing with really young kids or infants, things like, are they having as many wet diapers as they normally have during the day? Are they lethargic? In other words, they're not as playful, they're not as attentive. Are they not feeding as well? Like, those are major red flags where they need to seek medical attention, usually in an emergency department. And then there's other things with older kids, if they have, as Dr. Kulik mentioned, things like vomiting and diarrhea, for instance, and they can't keep anything down, no matter how much fluid you're trying to get into them. Dehydration can occur with any viral illness. And so it's important to have those discussions with parents to let them know when they need to follow up, either in the office with us or in the emergency room. And we have to make parents understand that we're there for them. So if a day goes by and they're still not happy with the way things are going, we're going to have another conversation or another interaction with them. Mm-hmm. That's the nice thing about the continuity of primary care, whether it's pediatrics or family medicine, and whether it's a nurse practitioner, anyone that's involved in primary care.
And we know how reassuring that would be for parents, because all of this is very frightening, and it's not, I guess, as easy to just simply go into a hospital and get treatment unless perhaps that's a recommendation or depending on the symptoms. I do want to have this conversation, though, about pregnant people who are testing positive for COVID-19. Dr. Kulig, what kind of difference is the vaccine making in those who are pregnant and they are vaccinated?
We've been worried about pregnancy and the risk to outcomes of the pregnant person, as well as the baby prenatally and postnatally, for a long time. We've known very well that pregnant individuals can get more sick. They could have preterm labor and all sorts of other complications. We know that the vaccine helps to minimize vaccine or illness-related burden. You're much less likely to have a negative outcome in the pregnancy. You're much less likely to have preterm labor, to have a low birth weight baby. The baby's less likely to get COVID in utero and afterwards if the pregnant individual is vaccinated, which is why there's this big push now to make sure that all pregnant individuals do get their vaccines, the full series, and even boosters later on.
And just to follow up on that, why is it that pregnant individuals seem to be getting a little bit more sick? Does it have to do with that person's immune system while they are pregnant? Are they more susceptible to falling really ill?
Exactly. So when you're pregnant, your immune system is suppressed so that you can protect the baby, which is a foreign body to that individual. So because you have a decreased immune system, you are more likely as a pregnant person to have bacterial infections, viral infections, and potentially more severe illness like from COVID.
Dr. Kurel, we have heard from a number of people who are trying to get their booster shot right now. We know it's not easy. There are, mobile clinics, walk-in clinics that people are lining up at for hours. Do you think there should be consideration for a specialized vaccine clinic for people who are pregnant and are trying to get access to that booster shot right now?
Yeah, that's an excellent point. I mean, I want to remind the viewers that, the call for pregnant individuals to get vaccinated against COVID-19, I wouldn't call it a new call. I'd call it a reminder. I mean, most of my colleagues in family medicine that do low-risk obstetrics and my obstetric gynecology colleagues who deliver babies, they've been, talking about the importance of this along with our public health colleagues, since the vaccine, shortly after the vaccines came out. So to me, this is a reminder. We're all trying locally to fit in these patients wherever we can. I mean, the Ontario Medical Association sent out a memo yesterday. There was a letter from the Chief Medical Officer of Health that talked about the importance of pregnant individuals getting vaccinated. And we're having meetings locally to try to figure out, how do we get them in? The clinic I work at through our Ontario Health team in Markham Stouffville Hospital, our family doctors and obstetricians are working together to create spots for pregnant individuals to come in and get their vaccines so they're not waiting a long time. And I know there's other local strategies that are being put together, like, as you said, pop-up clinics to try to prioritize these patients. And I think everybody's making that effort locally. The problem is a lot of people want their third doses. So we're going to do our best to continue to send clear messaging to pregnant individuals and everybody else that are high priority, people with complex medical illnesses, to please roll up your sleeve, get your third doses. You can book online. You can call that 1-800 number, and let's try to get everybody in as quickly as we can. And I think over the next few days, there will be even more spots that open up as local public health units prioritize these patients even more.
Dr. Kulig, we're hearing for the most part children who end up testing positive for COVID-19, the symptoms are mild and they will recover. But we are now hearing way more about children who are becoming infected, in some cases going to hospital to get treatment. Does this speak to the widespread transmission that we're seeing in this province and right across the country?
Exactly. By and large, kids do very well with COVID. They have throughout the pandemic. Most kids are asymptomatic or minimally symptomatic, have typical viral symptoms, and that's it. But if you have enough people with COVID, a small percentage of those people, adults and children, will get sick. So if the numbers are high enough, we will start to see more kids getting very sick and sometimes kids dying.
And Dr. Kurel, pretty concerning to hear of a report of some babies in Hamilton and the Ottawa area, 6 babies who are now infected with COVID-19. The mothers were not vaccinated. Can you maybe speak to what happens within the body if a mother is vaccinated during pregnancy and the antibodies that can be transferred to the baby?
Yeah, so the consensus is that when antibodies get transferred to the baby, when a pregnant individual is vaccinated, they develop antibodies to protect them against COVID-19. And then when they deliver their baby and the baby has some of those antibodies that can last after birth, for several weeks. That's going to add extra protection for the baby, right? So that's why we're trying to, again, remind all pregnant individuals to please have these conversations with their provider and to get vaccinated to protect yourself as well as your newborn. I think the other thing I just want to mention to parents out there is that, kids under 5, unfortunately, can't be vaccinated yet. We haven't approved the vaccine for them. So the other things that are really important to do is, we want to decrease unnecessary contacts, right? So having a big birthday party right now is not the greatest idea. We want to make sure that the parents or the siblings that are eligible to be vaccinated get vaccinated, so you have that extra protection around the newborn of the child that can't be vaccinated. And obviously, whenever possible, when you're talking about kids under 5, if they need to be masked, we want to make sure their mask is being worn properly, it fits properly. So the public health recommendations that we've been using to protect us against COVID-19 transmission, that hasn't changed with Omicron. We've got to be a bit more vigilant about it. And if we follow those and we try to vaccinate as many eligible people as possible, including pregnant individuals, then those that can't be vaccinated yet will benefit. And again, it's more that community coming together so we can all get through this Omicron wave as a community.
Dr. Grill, Dr. Klinik, we know so many parents are paying so close attention to what you had to say this evening, so we do appreciate you taking the time to speak with us this evening. Thank you.